Good afternoon, everyone. Thank you for joining our St. Luke's Virtual Health Talk series. This will be our last presentation for our fall series. And please keep your eye on stluke'sonline.org/health talks to see what's coming up in the new year. My name is Erin Buell. I'm with St. Luke's Wood River and part of the organizational team for these presentations. Today, as you know, we're doing our talk on vaping, prevention and treatment. And before I introduce our presenters today, I'd just like to go over a few little housekeeping points to help you manage your controls on this presentation. First of all, we have a disclaimer. Please note that the information contained in our production and in the video should not be construed as medical advice or instruction. So if you do need medical advice, please contact your healthcare provider. And this video and all of the content provided within it, such as texts and graphics and trademarks, logos, is the property of St. Luke's Health System and our prospective licensors. This video is being made available to our registrants for a limited time for personal and non-commercial use and for the sole purpose of viewing the video presentation. You will have the opportunity to type in questions. All of our audience today is muted, both your picture or video part, and you are muted for the audio part. So if you would like to ask a question or participate with comments, just select the Q&A tab. It's usually at the top of your screen and with a little question mark in a conversation bubble. It says Q&A. And just click on that, type in your question, and then send the question to us with that little airplane symbol that you see in this slide. And we will monitor those questions for you. Our presenters today are asking that we keep track of those questions, and we will get to those at the end of the presentation. But type them in as you're thinking of them, and that will help you keep track of what you are interested in circling back around to. All right, so enough on all that. Now I'd like to just take a moment to introduce our presenters today. We have Ann Daggett. She is a licensed clinical social worker with our St. Luke's Lifestyle Medicine. And she is in South Boise, the YMCA, and other spots where she does that outreach in lifestyle medicine. Chad Franklin is a registered respiratory therapist in our St. Luke's Respiratory Therapy System. We also have Vicky Jekich, who is one of our community health workers and a manager in our community health program throughout the system. Really great assets for us in our larger St. Luke's system. And without further ado, I'll turn it over to you guys.
All right. Thank you, Erin, very much. And thanks, everyone, for joining us. Again, my name is Vicky Jekich, and my colleagues Chad and Ann will be joining me at different junctures of this presentation about vaping prevention and education and treatment. Our agenda today looks pretty full, but we wanted to make sure we hit the highlights. There's a lot of information to cover about the e-cigarettes, a little bit of background I'll cover, and then Chad will be taking over and talking about some of the concerns, the myths, some additional clinical information, and then I can provide some marketing messaging and other updates relative to the policies. And Anne, of course, will take us home with all the treatment support information and resources available, because there's some great information and great resources here across our state, certainly, and across the country for those who need that information. Okay. All right, I'll begin with just giving some background information. Certainly, many of you may be familiar with these devices, but wanted to just make sure we're all on the same page as to what they look like and how they perform, if you will, as an electronic cigarette or vape device, as you've commonly heard that component or terminology, excuse me. So the components of the device, there's a mouthpiece. It's a battery-operated device that has a cartridge, if you will, that holds some liquid, e-liquid as it's been referred to as, or juice. You may have heard of a term as e-juice. And then there's a battery contained therein that operates in a manner in which it can heat up the liquid, which is then vaporized and heated with the heating element. And again, through the mouthpiece, the user can then expel some vapor clouds and such, and inhale, of course, some of the properties that are contained with this particular device, including nicotine. Some of the more common products have evolved over time, and this is just a quick overview of the timeline. I just wanted to hit some key highlights for those of you who don't know the history about the electronic cigarettes or vape devices. Back in 2003, thereabouts, there was a Chinese research pharmacist and inventor who started creating and inventing this particular device and had it on the market in the Chinese area under the name Ruvan, and it was intended to be as a cessation or a quit device, as well as a cigarette or tobacco product substitute. And again, over time, I won't go into great detail on a lot of these, but I just wanted to call out a few key milestones. The original or early devices of e-cigarettes had the original look and feel of a traditional cigarette format. And then these battery operated devices evolved in format and look and feel over time. And in 2015, the Juul device, which became very popular amongst teenagers especially, was released. And as time went on, there's some additional devices and new formats that hit the market. As you see, there's some even more newer devices, if you will, that don't even look or resemble any of the tobacco products. They are open pod systems, and they have different formats that allow for not just concealment, but also ease of carrying and even resembling and incorporating some particular types of tools, if you will, beyond just using it as a nicotine delivery system. So there's a watch format that has not only the capability of using it as an electronic vape device, but also tells time. And ones that play music, and certainly the popular Juul device is one that looks and resembles a jump drive. Excuse me. And then with these particular devices, more currently, they have expanded in use. And unfortunately, for our youth especially, we've seen a great amount of use for other products beyond the nicotine delivery system. So alcohol, vaporized alcohol in these devices, and more recently, the wellness vapes, as they refer to them as, not nicotine per se, but they have had other deliveries using the vapor device to deliver vitamins and other types of wellness properties and products. Unfortunately, these are not proven claims of being a resolution for wellness, and they do lack safety testing. And certainly, there's some long-term harm that has been highlighted through various research and publications. So the jury is still out as far as the positive properties of these wellness vapes, and the concern is it's a gateway to other products, including the nicotine and drug products, if you will. And those drug products include those illicit drugs, at least in the state of Idaho, of using the products for marijuana use, which can be in either liquid form or through a wax format. And it's very popular, again, amongst the teens. As you can see with this particular slide, there's a lot of literature and a lot of news stories that are coming out that highlight the use and the popularity of these devices for marijuana or vaping with THC. The other concern beyond using them for the drug purposes is the content of the THC levels of these products that are typically 40 to 80% higher than what has traditionally been seen with marijuana concentrated products. And they can be, again, up to 4 times higher than what we've seen in the past as well. And for those newer formats, the concealment is quite a concern amongst parents and teachers and others. This particular image shows 4 devices that are in the area of other products that are, you'll see a typical office or at a desk. But what you're seeing with the red arrows are actual vape devices that have the particular format that are used for other office needs, like a pen format, highlighter format, and even a USB format. So again, they've been disguised in a lot of respects purposely to conceal and make it easier for users to utilize these products in a private sort of way. In addition, some other marketing of these products have been utilized to incorporate the concealment through backpacks, phone cases, and even baseball caps. And as you can see, this particular vape was hidden in the particular drawstring of a hoodie. And again, these particular products are concealment formats. So now we'll switch over to what you should know about vapes, and we'll be digging a little bit deeper here. And I'll hand it over to my colleague, Chad.
All right, go ahead and take control here. All right, so we'll kind of go dive in a little bit more of what's in the vapes and actually what's being introduced into the body. And a lot of this is foreign material, or it wasn't approved to actually be inhaled versus being ingested. So e-liquid and ingredients, as you can see, it's one of the more common is going to be propylene glycol, vegetable glycerin, FDA approved for certain flavorings. And a lot of that is cut down with other chemicals to make it palatable, because actually when they first create the vape juice and the actual flavor of it is not palatable at all. It burns quite a bit. It almost feels toxic, like you're ingesting pretty much some chemicals you'll find underneath your common sink or bathroom sink. And actually we'll see later in some later slides that is actually a lot of the materials that are used. But then some of these other chemicals are used to cut that down and make it more palatable, make it smell better, make it taste better. So once you add in, sometimes you may hear about nicotine salts, and what is that? So that's benzoic acid and nicotine combined. Once it's heated up and blasted out, then it becomes a nicotine salt. But the concern here is, as you can notice in the little pod portion, that little pink and blue you see on this slide, that's the actual pod juice. It's a higher concentration, so they can deliver higher concentrations of nicotine through a lighter puff. So as time has progressed, they've found more ways to increase the dosage per puff and to reduce the volume, so that way it's easier to carry, it's easier to pack, and also as people progress in their addiction, they can satiate that even more. So all of a sudden, X amount of milligrams is no longer giving them that kick or that feeling they want, or they want more. So then it's just kind of a pathway into, similar to a drug use or an alcohol use, where they need more, because they're losing that effect of what they had before. I like this slide a lot. This one kind of really gives some understanding really what is going on versus traditional cigarettes, and not that traditional cigarettes are a better option, but just to give you a perspective, because we are more familiar with the cigarettes. One pack of cigarette will come about 20 milligrams of nicotine, and then which you'll have about 20 cigarettes. Okay. Once you have one jewel pod, is going to be the concentrated dose. One equal to that will equal 41 cigarettes. So that's just one jewel pod, one actual pod that goes in the jewel device. If you've ever seen anybody or know anybody that is using nicotine, they oftentimes, and they've been using it for a while, they puff on it all day long. It's almost out of habit or a tick. They'll actually be puffing on that without even realizing it. So as you go into more, these one puff bar is equal to 50 milligrams. So it'll be 50 cigarettes. The Sorium pod, which was coming out as they wanted to have more and more concentration, that's 90 milligrams, which is equal to 90 cigarettes. So just one pod of the Sorium brand. They're going to take in one. And through studies, they see that a lot of users have been going on for a couple of years. They may use 1 to 3 pods a day. So now if you equal that out, you're nearing the area of 250, 300 cigarettes in a day. And people aren't really realizing that that's how many they're taking in. And contrary to belief and advertising, all vapes are containing high levels of nicotine. Even if they say they're only for therapeutic reasons, they're for the vitamin usage, they're all having this nicotine level. even if it's trace amounts, but they're almost always higher, way higher than trace amount, and that's to help with that addictive formation. There is a plethora of effects that come on from the nicotine, just they do with natural cigarette or traditional cigarettes. With the vaping juices, of course, again, your concentrations are higher, so you're going to have even more of these symptoms, and it's pretty much encompassing the whole body, central nervous system, your lungs, obviously, your heart, your joints, even down into pregnancy. They're even seeing, and unfortunately, some of the studies are still in their infancy, and COVID actually kind of made that kind of slow down a little bit. But even when for the little bit of time that they've had, they're showing type 2 diabetes in the children later on in life, obesity, hypertension. These things are following through with them, as well as respiratory issues of their own. Increased blood pressures, nausea, sleep issues. So as we go into this a little bit further, you'll start seeing some of the effects on kids, especially as well as adults, with depression and other things that they struggle with. This only increases to that problem. So in the adolescent brain, one of the really interesting but unfortunate things is as children are growing, the synapses that are growing and they're actually forming habits, these things are getting disrupted and they're actually growing different synapses maps that is helping them become addicted. So children and adolescents that start vaping earlier in life are becoming more addictive and they're having a harder time getting off of these usages versus an adult. And it's a struggle for all ages, but especially for those adolescents. And not only that, they have peer pressures that are also coming in. There's a lot of it available to them in the school, no matter what anybody might want to believe. It is all over the schools, as even THC. It is quite common as I have gone to some of the schools. Police force has been there and helping educate as well. It's not uncommon that there's even not just the kids in school that are selling these to each other. They're getting them either from across the border legally, or they're creating it through their own THC additives. Or even alcohol, or just starting to add their own juice mixtures and other chemicals so the kids don't know what they're taking. There's even been reports of adult activity outside of the schools selling these as kids are coming out to help increase their usage, and so they can make money off these without actually looking to see what effects it's having on the children. Their impulse controls, and it's starting to hit their frontal cortex a little bit differently. So their decision making and everything is starting to be hindered as well. And their learning ability. Not only are they struggling in their social circles, but also just in school, being able to sit still, being able to learn. And because as they're sitting there in class, they have this drive and they have this nicotine desire that makes it struggle for them to actually be present in class and be available to learn. So with the current e-cigarette usage, it's doubling the odds of them having depression compared to those that have never vaped. This is worse with kids that already have symptoms such as ADHD. It only worsens those symptoms, and they're far more likely to continue down that path. And they're going to need more prescription usage to help curb their depression and anxiety. And as they yearn and need more of this vape material, it's only going to increase those symptoms for them, and actually becomes they're about 4 times more likely to go down into traditional cigarettes, as well as into other traditional drug usage and alcohol usage. It not only quits break the addiction and reduce their health risk, but it can also improve their mental health by quitting. But the challenge there is actually how to get them to quit. There's only so many resources available to the community with depression and anxiety, and there's not a lot of funding in this area. And unfortunately, there's still a lot of research that needs to be done in order to see how we can help these kids curb this habit. So here's an illustration kind of showing the difference between a vapor and an aerosol. A lot of people are thinking, oh, it's just a water vapor. Oh, it's just an aerosol. I see that commonly in a lot of things that we use. But actually, once the person is breathing this out, or it's coming out of the vape, once it's heated and pressed out, it's actually being canvassed over all of the areas that around them. So third hand pickup and everything is going to be much more of an issue. And these chemicals are actually being forced out into all those around them. So there's always a lot of different chemicals that you may see in the vapes, but you may not be very familiar with what the chemicals are. The propylene glycol, that's commonly found in antifreeze. Acetone is your common nail polish remover. Ethylbenzene is actually used in paints and pesticides. Formaldehyde is commonly used for embalming fluid. Nicotine is our traditional cigarettes. Rubidium is going to be actually used in fireworks and explosives. What do we know about e-cigs? That they do emit nicotine and harmful chemicals, contrary to belief in other forms of advertising that you have out there. There is increased inflammation and causes of cell death within the lung tissues, as well as other parts of the body, but especially the lung tissue causes scarring in some of the bronchial passageways and into the alveoli, which is going to be our sponge material that's going to absorb oxygen and be able to oxygenate the body. So whenever you have a reduction in oxygen and increased pressures, when in these areas of the body, it's going to have organ damage, whether that be minimal or maximal, depending on the exposure and the amount of time they've used this. And then some of the acute issues is going to be a volley. So that very much mirrors and mimics pneumonia, although they're not having a viral impact, but it's actually giving the same diagnosis and actual effects from something similar to a pneumonia. There's been reports of explosions and toxic exposure. For toxic exposure, it's pretty common, actually, unfortunately, with kids and animals. You can refill these devices, and that concentration is in a bottle, maybe 20 mils or 50 mils, and all of a sudden, a baby or a dog could get into those and actually drink or take a very large one-time concentrated dose. And there's been a lot of emergency calls and unfortunately deaths actually because of this large ingestion all at one time. Explosions are from the batteries and some of the chemical heat up and everything that's going on. There are flammable. They have exploded. They have actually had large injuries to people on their hands while using them or in their pockets during carry. As I mentioned before, teens are using these e-cigs are 4 times more likely to use and move into cigarettes. And again, once they are starting to no longer get that effect, or they're within those social circles, it starts to lead them into other things such as THC usage, especially since our THC usage has increased so much because of our border access. Advertising appears to be moved towards the young demographic, and there was a lot of argument back on this that it wasn't happening, but actually through social media, they've actually has been some big developments this year in lawsuits actually showing different avenues of social media such as Instagram and Facebook and other areas, Twitter, TikTok, things like that. They're actually using underage children to help endorse these products, and they are obviously going towards them. They're looking at ways to hide the devices, ways to use it on their apparel, and actually show social acceptance by using these, make them feel better, help them with their depression. Oh, they're stressed out. This is going to be a helpful thing for you. But unfortunately, once they actually start using these, as we mentioned, it's actually going to increase some of those symptoms with depression, anxiety, and feeling of loneliness and being left out. So second and third hand vapor and aerosol. So whenever they take this in, it creates quite a large plume and actually travel quite a few feet, 6 to 10 feet, pretty commonly. And when it comes down and sits on furniture or onto clothing, onto your hands, your skin, everything else is picking these aerosols and chemicals up, and it suspends there for days to hours at a time, depending on what type of device is used and or concentrations. So you can kind of see here the third hand smoke, and it's really hard to clean these surfaces, and they're high traffic surfaces. So the exposure to these children and animals and pets is quite high, especially for children with the absorption rate that they have through their skin. They actually take in quite a bit through the third hand direct exposure. Okay, and I'll go ahead and turn over to Anne.
Actually, I'll take it over from here on the marketing end, and then I'll hand it over to Ann. Absolutely. Thanks, Chad. I'm just going to hit a couple of highlights of some of the marketing and promotional efforts of these devices. Certainly, this is not an exhaustive list, but it just gives you an example of some of the claims that have been marketed over time to entice people to purchase these products. Among them, and some of these have already been highlighted by Chad as well, they're safer than the traditional tobacco cigarettes. only 4 main ingredients compared to 7,000 chemicals in cigarettes. They smell better. There's no such thing as secondhand smoke. It's just vapor. You can vape where you can't smoke. And then, of course, the social media impact and that the third-party influencers were paid to make this look cool. So I want to just tackle each of those specifically for a moment here. When we're talking about being safe, safer than cigarettes, certainly with the tobacco or combustible products, there's lots of chemicals, as the next bullet about the 7,000 chemicals are contained therein, are a concern with those traditional tobacco products. But they're still harmful as far as e-cigarettes and vapes are concerned. So we can't claim that they're safe for people to use because they still have the chemicals, as Chad identified, and certainly they're inhaling the impurities into their system and then exhaling through the secondhand and third-hand vapor that's affecting people around them or even the animals around them. So yes, they may be safer than tobacco, but they're still not safe in general. And from the smell, of course, they may smell or fruity or appealing, but again, we have to understand what's happening when we inhale that into our bodies, whether it's secondhand smoke or vape, or certainly directly into our lungs as the user of these devices. And again, I won't go into the example again, but Chad did highlight about the secondhand vape and the third hand actually. And then where you vape, you can't. You can vape where you can't smoke. And that's maybe from years ago, but over time, as we realize and those who have businesses or just public sector groups and such, recognizing how harmful these particular devices can be, there are more and more restrictions, again, trying to keep the community safe and customers safe and such. So again, vaping is not necessarily a product that can be, or an activity that can be done where traditionally smoke was prohibited. Now it's vape as well as smoke is restricted. And again, from the social media perspective, who are these influencers trying to support? Are they supporting the young folks or even those who are interested in purchasing their products, these products that they're promoting, or is it the tobacco companies and those who are benefiting from the revenue generated from these products? So bear in mind the marketing of these products and the social media influencers and others who are speaking in support of them aren't really thinking about the health impacts on individuals per se. So keep those concepts in mind. The other thing I wanted to mention too is some more current policies and restrictions that have been highlighted over just within the last year or two. This particular slide highlights the FDA has prohibited the sale of pre-filled cartridges of these e-cigarettes in other flavor, in any other flavor other than menthol or tobacco. Because over the last, 15, 20 years, we've seen a steady increase of the use of these products, and certainly from the youth perspective, even more so. And that in 2018, at the time, it was declared that it was an epidemic for our youth, and it continues to be a concern, as Chad pointed to. And what I've seen too is I go out into the schools and present vape education and prevention to junior high and high school students and even adults as well. There's a lot of that they don't know, and that's why we want to share this information. And the flavoring was an enticement and a marketing effort to get people to use them, especially our youth, when their flavoring at the time early on was cherry flavor or fruit flavor or cereal flavor or candy flavor. Certainly the appeal was for our youth to use them. But the restrictions now in place that the FDA has now prohibited the sale of these flavorings other than menthol or tobacco flavored are in place. And then, of course, other states have, at the local level, put in even more restriction on those particular sales of products. Now, if you know someone or maybe you yourself are using the product, certainly and we'll go into more detail about the cessation and treatment. But for those of us who have young people in our households or we are mentoring and certainly supporting, if there's a concern that you have, how can you engage? How can you communicate and work with those individuals to help them get on the right path of not even using these products, or if they are using them, how do you engage and help them redirect them to the proper resources that are available? In this respect, or in this particular slide, we're talking about from a parent's perspective or in the home or work environment, what changes do you want to look for individuals, especially our youth? Is the changes in their clothing, if their room is smelling more fruity than usual, if they're depressed? Certainly, as Chad alluded to, vaping and mental health go hand in hand. Oftentimes, it can be seen as a coping mechanism for those who are dealing with mental health. So if they're depressed and you are concerned about usage of these products, that's something to be a flag. Certainly the moodiness and irritability, again, all these emotions and such that Anne will cover are things to look for. And looking at their grades, certainly from an academic perspective, how are their truancy and grades affected by this particular product, and certainly even physical changes. So those are things just to be observant of. But start the conversation. This is an opportunity to have a conversation, again, not a lecture. You find the right time, be patient, listen, and certainly avoid that criticism, encourage that open dialogue. Again, it's starting to engage and open that dialogue with whomever you're talking to with this particular concern. Instead of, again, lecturing or pointing fingers and we need to talk, certainly, again, open the door for conversation. Start that open-ended discussion about how you're interested in learning more about them and what their concerns are, and be a good listener. I know it's hard to do sometimes, but again, that's a great opportunity to engage. And avoid, again, some of these ways in which it shuts down the opportunity to have the conversation by these leading prompts of you don't vape, right? But again, terminology is another communication vehicle of using those words directly and succinctly of vaping or juuling, referring to those specific products that they use. And that conversation doesn't have to be verbal all the time. There's a lot of communication going back and forth with many of us through our devices as well. So again, keep that discussion going, and certainly look at other resources that are available. I know Anne's going to cover that as well. There's some great articles from trusted resources who can, again, help open up that conversation and dialogue. And what else for you to know? Certainly, as a community member, as an individual, as an employer, whomever, just be factual, fact-based. Plenty of great resources, again, to gather the details, even the most current legislation that's going on across the country and here within our state or local level. Know the facts and talk about them. Again, that conversation is important. Speak with those who are in the know, whether it's a healthcare provider, public health districts, other trusted resources, and encourage folks to quit, whether they're youth or adults. And again, we'll talk about the resources, and you as an employer too can look at ways to encourage and prompt those opportunities to educate and raise awareness. And many resources like our public health districts are willing to work with local businesses and others who are interested in educate. Okay, I'll hand it over to Anne while she talks about treatment and dependence.
Well, I just wanted to say thank you to Vicky and to Chad, because every time I enter into this conversation, I get very encouraged by the number of people who are interested in this topic and who are willing to go out there and do education. My role is really more on, so what happens when folks find themselves addicted? And so I think it's really important to have these conversations because typically, in my experience, people don't necessarily wake up one day and say, I want to become addicted to a substance. It's usually through a series of events. It's a series of exposure. It's a series of lack of education. And so I think this combination of having Chad, Vicky, and myself in these presentations is very, very powerful. So, and your participation in this in this conversation as well. So I think when we look at nicotine dependence and support, it's also really important to cover this other myth, is that e-cigarettes will help people quit smoking. And there has been some discussion in other areas that this is actually a great opportunity for people to quit by using e-cigarettes. But unfortunately, that's really just not the case, as both Chad and Vicky talked about. It is not currently FDA approved. And one of the things that we actually see in the literature and in use is that typically people will begin vaping and potentially start smoking or use other substances for a variety of reasons. And Vicky touched on that. Chad did a great job also of really exemplifying that, there's nicotine in these products, and we really don't have any way to control specifically, the exact amount for products. He definitely, there is definite increase in nicotine consumption. And another very interesting thing that we have to understand about addiction is it's both physiological or chemical, as well as behavioral and emotional. So there's those three components. The addictive part of your brain is activated and also reinforced behaviorally. And we'll go into that here in just a minute when we talk about treatment. And again, Chad did a great job in talking about the substance of nicotine in these products is actually what activates the addiction process. And so, we've got all various of these other harmful chemicals. But when folks are asking, well, what and how does addiction really get initiated? It's really through that chemical of nicotine. And this is a very simplified slide showing that when we do inhale nicotine, it gets to our brains very, very quickly, within 7 to 10 seconds for most inhaled products. And our system is just not designed to receive this level of nicotine. And it actually then really wakes up different nicotinic receptors within our brain. And again, this is we could spend hours and hours talking about the physiology of addiction, but we have to understand that this reward system is being activated by this nicotine. And when the system is activated, there's a certain amount of dopamine that is released, and that's that feel-good hormone that we get, and can be the initial allure for individuals who are ingesting nicotine, because it's that it's kind of that what people describe as kind of like that calming, or that smokers or vaping hit that's really awesome. Well, physiologically, just as we are that dopamine is released, it actually comes back down, and our system is saying, hey, wait a second, I want more of that. And so this cycle of wanting more and more and more begins to be initiated. And the other part of this addiction process that I talked about is also behaviorally reinforced. So we also start to see people's patterns of behavior where they are associating that high with people, places, and other things. So when we think about treatment, we have to be not only looking at the physiological aspects of this particular process, but the behavioral aspects, and then the emotional aspects as well. So, when we talk about behavioral triggers, these are just a few of those that people can find themselves associating with their use, right? Daily activities. And so these are the things that we are going to, and emotional responses that we're going to have to be aware of and identifying in treatment, because this whole process, this brain construction kind of has to be unwound. And so that is definitely a part of the treatment process. But what we do find is that for treatment, the best recipe or plan for lifelong quit is combination therapy, and that's medications and coaching. So addressing that physical aspect of addiction, as well as those behavioral and emotional components. We did talk a little bit, or Chad mentioned about some of those physiological withdrawal symptoms, is when people are in treatment, we have to be aware of, and these are some of both the physical issues as well as the psychological symptoms of withdrawal. So when people first enter treatment, we want to be talking about, what physiologically you can anticipate. Not everyone will have all of these, but it is a real part, and it also kind of sets a stage for why some individuals will not want to continue with treatment, is because this isn't fun stuff to go through. And that's why, again, I talked about the physical, behavioral, and emotional aspects of treatment. Now, the physical aspect, when we're going through withdrawals, we're wanting to be using some type of nicotine replacement. And I know that sounds a little bit counterintuitive. Why would we be trying to treat a nicotine addiction with a replacement? But it goes back to that brain physiology, right, of how activating these inhaled substances are. And the nicotine replacement is basically designed to be delivered to the brain a lot slower, right? It's not necessarily going to have what I call the Shazam factor, that 7 to 10 seconds of impacting the brain, where we're trying to reduce the amount of time that nicotine does get to the brain to kind of slow the process down. And so we have things like long-acting controlling medications, the nicotine patches, as well as prescribed medications. Wellbutrin and Chantix are two very, very common ones. We also then want to be looking at, in addition to the long-acting controllers, is the short-acting. So these are more for breakthrough symptoms, right? For situational, they are at lower dosages, but can be helpful in combination with helping in those situations where, patients are activated and they can anticipate that. And so we really want to do those combination. So in addition to that nicotine replacement, we're also looking at how to, in a sense, retrain the brain to deal with stressful situations, different emotions, or even situations where folks have found themselves using. And so that's definitely part of the treatment process as well. I like the slide, and because it really illustrates that it's not a straightforward process, in the sense that sometimes folks who enter treatment are kind of expected, well, hey, you just want to do this, or it's a matter of will. And I think it's really important to understand, when folks are in treatment, it is all three of those aspects: physical, emotional, and behavioral things that we're trying to come out with our treatment plan. We do have an incredible amount of resources out there for folks, and sometimes we're not always sure where to go. But this is at St. Luke's, at the Nicotine Dependence Treatment Center, and that's where I'm located in with lifestyle medicine. We can also field questions, right, from anyone in the community. So you don't necessarily have to be a patient of ours for us to be able to respond to your questions. So please utilize us as a resource. We also have an incredible resource in the state of Idaho with Project Filter and the Smoke-Free Idaho. So again, wherever you're finding yourself, wherever you practice or you live or work, just recognize that there are folks who want to help. And there's some national cessation resources that are also pretty darn incredible. All of this information will be available to you, and I really, really encourage you to be connecting with these folks, especially if you yourself are struggling with this type of addiction. This is also, again, another really great resource for folks. And then we've got some apps that are really exciting in the treatment realm. A lot of my practice is in combination with some of these mobile apps. So in addition to some of the oversight with those nicotine replacement therapies, behavioral strategies, these have been amazing. So again, encouraging folks to take a look at these and recognize that they're definitely out there. Additional online resources. The CDC has also done an amazing job with getting programs and materials put together for quits. So we definitely want to recognize that no tobacco or nicotine product is actually safe. And when we're talking about the aerosols, the problematic, in addition to nicotine, all the other chemicals that are associated with that, and the addictive and dependence. Chad mentioned you did a beautiful job of talking about the adolescent brain, and that's an even more delicate space in which neuropathways are still developing, and where nicotine can pretty do an incredible job of disrupting. So with that, I don't know if we've got some great time left for the audience to, if anything in the chat box that we want to talk about, or my other colleagues, Vicky or Chad, if there's anything else that you wanted to note.
Thanks, you guys. There is a question here that came in a little bit ago, and we were waiting for the end, but are the same harmful components in the THC vape pens the same as the ones found in the nicotine vape?
I mean, I can speak to some of the studies that I've gone through, and some of the articles that it's almost exactly mirrored. Even the THC ones still are through studies. Over 90% of them still find nicotine in the THC as well. So it's still an additive just to help with creating that addiction. And then all the background chemicals and additives that are in there are very commonly in either one of those options. They may not always be the exact set of complete makeup of the exact same items, but they're all going to be comprised of those common usages of different chemicals. Yes.
Great, thank you. And again, type in your questions now if those of you that are participating today have any. Type those in. We will be sending out to all the emails that came with the registrations, the resources provided in a PDF format to you. If you don't get that email, then reach out to us, and I will put an email address on here for you where we can connect with you and get you that information.
So I had a question posed, and it was relating to how the youth get their hands on the fruity flavored vapes. So it's more difficult now, of course, because of the restrictions that the FDA has put into place. However, the vehicles are channels in which the young people are getting them, because again, it's nationally, you have to be 21 years and older in order to purchase these products, whether it's fruit flavored or what have you, menthol or mint, I should say. But it's through their resources. It could be a friend, it could be a sibling, could be on the street corner, other places. Unfortunately, the young people are getting access to these products through a variety of vehicles. And certainly from a prevention point of view, on the education and outreach side of the house from community health, it's really trying to educate the youth as to why they shouldn't even start using these products, understanding what it's doing to their body, understanding that the flavors, the fruity flavors early on when they're more readily available, were intended to get people started at a young age, and they're pretty much customers for life because of the addictive nature of these products. So again, it's probably harder now because the fruit flavored products are no longer available, certainly at retail stores, but there may be other vehicles, unfortunately, through the internet and other folks who may be making them available through other channels. But yeah, that's a real difficult situation for our children.
Yeah, and I think the space to remember is online purchasing, and that's very much unfortunately there's not the same regulation in the online space. You can buy a plethora of different controlled substances even online, or not even know what you're getting. They come from out of country. That of course also entails some federal laws at times. But they do come in, and those oftentimes will contain THC even when the person isn't intending to purchase that. So, and you also don't know what other chemicals are coming in out of country space. And also to highlight, as we're talking about the youth and everything, these are being seen as kids as young as 5, 6 years old is not uncommon. So this is not just preteens and teenagers. This is very very young kids that are getting involved with these. A lot of times, even if they're not in the ability to purchase with money, it's either trading items at school, getting it from friends, being shared, or they're taking it from parents or other family members. But yes, 5 and 6 is not uncommon at all.
And with that, I just wanted to highlight that we are just in the beginning stages of understanding to the impact of COVID and the pandemic with this use. I don't have any hard and fast studies right now to back that up, but when kids and people experiencing those high amounts of stress, but also social isolation, and kids maybe having more free time on their hands, maybe unstructured. So we have seen, and again, I would imagine we're going to be learning more and more about the impacts of this pandemic on the increase in vaping. But it is something that I've in individuals that I've worked with saying that their use has increased or started relationally to the pandemic.
Yeah, and the pandemic brought on a lot of other mental issues and stuff, and depression, anxieties. That has actually skyrocketed. There's a lot of studies out there for that being the new epidemic is those. There's actually a ton of studies that actually showed, unfortunately, a lot of divorces and separations in families and stuff, and that was also what drove up the housing demand. So people turn to these items in that time. So it's just continued to be kind of a snowball effect. And I think the scary thing is, and it is a little easier for me, more fluid to talk about in the in the inpatient setting, when these people come in and they have a certain amount of we have an algorithm. We'll try to match the amount of milligram of nicotine that they're using, but it's not always perfect. Especially as I mentioned, they don't even remember how much that they use throughout the day. I've seen people take naps and fall asleep with it in their hand, like it's just there. They have to have it. So matching that demand is really difficult. And now if you think you take an adolescent and now you're going to put them through a treatment program, we've now got to do some other non-traditional things you'd want to do in order to get them to stair step off this, whether that's a nicotine replacement or something else, but to actually match that demand of what they were getting with just a patch. And they also don't get that physical satiation. That's really hard. And like cigarettes, many years ago, it was given in rations in the military. It was presented as someone with class, worth money. Through research and everything you see now, there's tons of effects, and we have COPD is rampant. It's the number 2 cost hit on the medical system because of readmissions are so common. And every time they readmit to the hospital, it's about a 7% increase per year on their death rate. So what we did, there's just such a lack of research on vaping. We're probably going to start seeing more of these long-term effects and outcomes in the next 10 to 15 years when people have been doing it for that long. And then all of a sudden we see this new disease that's a long-term disease that comes out. And that's the unfortunate part, is we don't know how far that will go.
And I'm going to concur with Chad on the outpatient side as far as treatment and how the algorithms that we utilize in matching the nicotine replacement does become very, very difficult when, number one, people don't know exactly what they're ingesting or how much. It's really been startling to me to see that it just creates different difficulties, as Chad mentioned, in the inpatient unit, and it definitely creates issues then for treatment for us on the outpatient side as well.
And if I can underscore too, and to follow up both you and Chad on the youth front, anecdotally, because I'm in the schools and have had requests from school teachers to provide vape education, and anecdotally they've shared how they have seen post-pandemic increase of course, of youth use in and around areas and such. And when I go into the classroom, my favorite graphic, Chad, is the one where it has the images of the cigarettes into the ashtray to show the comparison of the vape products and traditional pack of cigarettes. When I share that with the students to see the amount of nicotine one pod of a Juul device or any of the Sora and the other products there have compared to the cigarettes, their eyes certainly go wide open. And I have had feedback because I do a post survey where the students learned at least that the equivalency of nicotine is a concern. And again, I have them do the math. So in school, let's do math as well as health and show how they multiply out the number of packs of cigarettes that they are vaping, the equivalency of those pods. So again, being sure about what they're doing and having that impact. Oh, thank you for sharing that slide. Yeah, so showing the impact and things they like to do. Their physical activity is diminished. They can't compete in their sports. If they're going on to college, it's hard for them to concentrate because all they can think about is getting that next nicotine fix in between classes or something to that effect. So again, correlating how this is impacting their life, not just their health, but everything they like to do. So thanks for sharing the information, Ann and Chad, too.
And on that, we have a comment or question. This person has heard that there are shops in Idaho for 18-year-olds and up. Is that accurate?
Are you talking about vape shops?
I would
Now,
think vape shops. If Lacey, you want to clarify if that's not correct, but the question is just, I've heard that there are shops in Idaho for 18-year-olds and up. Is that accurate? So I'm assuming that's vaping or nicotine.
I know historically it was 18 at a time, but nationally, I think it was, Chad, what, 2 or 3 years ago, a
Yeah,
federal legislation was passed that restricted use and
yeah,
increased it to 21.
it should be that. Yeah, with the new law change, it's supposed to be a 21 and older for any kind of nicotine. So if there's an 18 and older shop, I don't know if there's a market of some other type of offering in that space that they are trying to find a loophole or something that they're selling something else. I would have to actually go and see. I am not aware of that.
Yeah, she clarified by saying the question disappeared, that her 15-year-old made a comment about that. So she was following up with the accuracy.
Right. Well, federal legislation was passed, and I don't have the year. It had to have been at least 1 year, if not 2 years ago. It was all part of the Tobacco 21 efforts to get legislation passed because years ago, 18 was the age restriction here in Idaho, but in other states it was 21. But from a federal perspective, they had passed the legislation. It's my understanding that all states across the country are now at 21.
Yeah, I think as someone just mentioned with the gas station, I think what may actually be happening is you have shops that may sell other things that might make a age requirement of 18 and older, but they sell these other items in the shop. But you have to be 21 to purchase. Same as an adolescent can go into a gas station where they sell alcohol, but it doesn't mean they can purchase the alcohol. So they may be allowed into the business, but they may not. Federally, they're not supposed to be sold the item unless they're 21 and older. That's probably what they're speaking about.
But good to know. Again,
Hmm.
Yeah, thank
information
you.
is everything. So being mindful of the myths. Again, this graphic is a great one to share about putting the myths aside of being safe, because you can imagine, to Ann's point about trying to help these folks be less dependent upon the nicotine if they're using 2 or 3 or 4 pods a day. And the students tend to like those jewels or those types of devices. There's a lot of nicotine on board.
Yeah, and depending on how far their addiction goes, I mean, obviously a lot of these kids sometimes don't have cash on hand, so they may go to other means, and sometimes some scary means of actually how to obtain these through trade or through other ways to find monetary value in order to purchase these. So that can kind of lead kids down a bad area and bad decision making if they are really that addicted in their current state and how bad they want another pod.
That's great. Thanks, you guys. Really great community information.